I bring in all the wishes and greetings from Speed Medical Institute behalf of all the faculty members of Speed and team of Speed to Dr. Suraj for scoring a very good rank number 200 in DM Medical Group in NEET SS session 2023. Congratulations to you, Doctor.
Thank you, sir. Thank you so much. Thank you, sir.
Great achievement and really wonderful to have you in this interview. And can we know a detailed background history from where you started till date?
Yes, sir. Sir, I have done my MBBS from NSCB Medical College, Jabalpur, Madhya Pradesh. I completed in 2015. Then I started my MD in General Medicine in 2016 and completed in 2019 from GMCH Chandigarh.
Okay.
After completing my MD in 2019, I joined PGI Chandigarh as a senior residency in medicine.
Very good.
I worked there for 2 years, sir. So in February 2021, I left from there and joined. So till the time of 2021, I was not decided to prepare for DM actually.
Okay.
I want to be a physician only. That's why I joined the SRSF in medicine only at that time.
Okay.
So after that, sir, after working in PGI, it was experience that the senior resident of various department comes and discuss the various cases of various specialties. So it becomes interest to do. Yes, I should also do a DM because it's a time to get a newer thing and to learn the medicine in deeper aspect. So initially, again, I was not decided in which specialty I should prepare. So during my days in PGI, sir, the academics was very advanced in PGI, sir. So endocrinology section was sir, very much important there. So I decided to prepare in endocrinology in 2021 February. After the in 2021, the exam was changed. Exam pattern was changed, sir, and the exam was conducted according to new pattern. Initially, it was decided to do a new pattern, but later on, again with the previous pattern, it was conducted in January 2022. In that exam, sir, my score was not very good actually. So again, I start preparing and continuous preparing. This time, I got this rank along with jobs, sir. I was not preparing with the complete study. Yes, sir, full-time study. It was not full-time study. I was preparing with the jobs, sir.
Can you share what all did, how you did, how many hours you spent, how did you read? Can you share your preparation strategies?
So initially, I used to read with my work 3 to 4 hours in a day, and the exam date was coming near. So I tried to increase my study hours. I used to saw the speed videos, sir, most of the time because it was not possible to write the notes and keep the. So when I get time, I used to see the videos, sir. And sir, morning hours, I used to see the e-notes in 1 to 2 hours, the PDF format. And when I get time, I saw the videos, sir. Later on, when the exam time came, again, I saw the e-notes, sir, again and again. So that thing was very helpful. And I left my duty 1 month prior to exam, sir, and give full-time preparation for 1 month, sir. So finally,
got it.
yes.
So now, which specialty you are interested in?
Sir, I am interested in endocrinology, sir. As per se, because as I told previously that the academic section in endocrinology was very advanced in PGI, sir. So the interesting cases I used to discuss there. Apart from the diabetes and thyroid section, we used to see in medicine only. They used to discuss the parathyroid disorders and developmental sex disorders, hormone deficiency disorders. They used to discuss there, and autoimmune endocrine disorders also. So I decided to do endocrinology, sir.
Comprehensive medicine.
Yes, sir. So one more thing, actually, endocrinology is the branch which prevent the development of disease. In every branch, we used to manage the complications. Endocrinology is the branch where you can manage the onset of disease. So that's why, and bigger part of medicine also, sir.
Correct.
So that is why.
And how many questions did you attend this exam?
Sir, I watched your video, sir, last video just before the exam. As you said, we should attempt maximum number of questions. So I attempted 146 question out of 150.
I feel that has given you good results.
Yes.
Very nice. So what is the message that you want to give to aspirants of DM Super Speciality?
Sir, the important thing is whatever the candidate has prepared in whole year or during whole preparation, focus on that thing only and read the same thing again and again rather than to reading new things when he or she is near to exam. And second thing, rapid revision, very important aspect of the speed learning app, because sir, the important areas, more frequently asked areas, excellently covered in that rapid revision classes of each specialty. So the rapid revision class is very good, sir. Maximum number of question I got from there only, sir, in the exam, sir. Even
This many students have told me in the interview now.
yes, sir, yes, sir.
We could see direct questions from the rapid revision. Direct
Yes,
questions
yes,
along
sir.
with the grand test. Last 3 grand test and rapid revision gave more questions in this exam, they said.
Yes, sir. This time the rapid revision was very much helpful, sir. Direct question from rapid revision, sir. And sir, there's one more thing for the future NEET SSS friends that they used to thought this thing that exam will be difficult and pattern is not decided that the exam will be difficult or will be easy or moderate level difficulty or very severe level of difficulty. So in that case, what I want to say that they should focus on the prepared portion only. Whatever they have prepared from the app or from the books or from the notes, whatever they have prepared, they should focus on that thing. Try to revise again and again rather than to looking the unprepared portion of worry of unprepared portion. Because sometime with the help of prepared portion, we can exclude the option of other questions. So we can reach to the correct answer, sir, with the help of this much stuff we have.
Doctor, you gave last NEET also, this NEET also, correct?
Yes, sir.
What is the difference in the paper?
Sir, definitely this time the exam was having some question. It's not typical for the super specialty level actually. We cannot say they are typical. They were not difficult questions per se, sir, but they are not for the super specialty candidates.
So they are not for PG candidates, they are for super specialty, correct? So you mean to say it is not just PG level, it's a little above that. That's what you're saying?
Sir, some question are of PG level, like side effect of antiepileptic drugs. So they are of definitely of PG level, but they cannot expect the same thing from the super specialty candidates. Because sometimes it's not possible to learn or recall all the pharmacology after doing anti-medicine. Side effect of each and it is not possible to remember or recall each and every side effect of all the antiepileptic drugs.
No,
So
but what you're saying, is it going to the basics or the level is higher? I mean, what is that you feel about the paper?
sir, actually, it was the basics, sir.
Okay.
It is somewhere in the Harrison, sir. It is not from out of Harrison.
Okay.
Whatever the antiepileptic drug they were asking, everything is in the Harrison. But how much table we will remember, sir? It is not possible to remember all the tables. How much we will study.
So out of the 150 questions, what percentage of questions are from Harrison? Can you tell like some idea about it?
Sir, maximum number of questions are from Harrison only, sir. Hardly 5 or 10 questions is out of Harrison, sir. 5 or 10 questions. So those questions can be solved with the help of clinical knowledge or clinical postings or discussion with the faculty members or senior or junior residents.
Okay. Great. So because this input might be required for the students who are preparing for next year. So that's the reason why I was asking such questions to you.
Okay.
So now we wish you all the best and all the success in years to come for a great endocrinologist in making and a super specialty in DM endocrinology. We wish Dr. Suraj Agarwal, is going to do great as an endocrinologist. We wish him all the best and all the success for all his endeavor in future.
Thank you, sir. Thank you so much.
Best wishes to you, doctor.